Welcome everyone to the Cycling Custodians YouTube channel. Today we are going to be using foam rollers to eliminate medial, lateral, and central knee pain, to lengthen the tissues of the quadriceps, ITB, Gracilis, and the hamstrings, and the calf muscles. So this is a program that I do after really long rides or intense physical activity, hiking, things of the sort with your legs. So first things first, I have to emphasize that you should be cautious in participating in intense stretching and physical activity without consulting your doctor or primary care physician if you have pre-existing or existing conditions. Also, a little bit about my qualifications. I've got a master's degree in exercise science, bachelor's degree in physical education. I have 2 years experience as an exercise physiologist and 8 years experience as a massage therapist. So this is the position that I'm coming from when it comes to remedial techniques used to eliminate or reduce knee pain and muscle pain and muscle soreness. So let's get started. This first one is going to be more of a warm-up, because if you go into this just trying to put a lot of pressure on individual muscle groups, it tends to be quite painful. So by starting to gradually increase the intensity as you go through the foam rolling program will definitely help make it a little more enjoyable experience and a little less extreme. So this first one is going to be doubles on the foam roller. So you're doing both quads at the same time. So starting with the foam roller underneath your kneecap, you want to walk your way up to your elbows, okay? Now you want to let your legs just kind of hang nice and easy, and you're going to gently walk your elbows back to get your hips on the foam roller, and then you want to drag yourself forward, making sure that you're keeping a nice joint angle underneath your elbow, under the shoulder, so you're not going to create any shoulder problems for yourself, and working your way forward. I like to flex the legs, give them a bit of a stretch, and come back down for 3 to 5 passes on this muscle group. Nice flex. Let's go one more. And working your way forward this way. Okay? So if you notice that you have a little more tension than you would like, then just make a couple extra passes. 2, 3 extra passes isn't going to kill you. And it'll also help you to warm that tissue, get the blood moving just a little bit better. The second one is going to be a variation of the first. So instead of going straight on both legs, you're actually going to start to point your toes, both facing the same direction, both left, both right, to work on the lateral and the medial aspects of your legs respectively. Okay? So starting off here, same position, back down to the quads, point your toes to the same direction, and you want to work your way back, again, minding those joint angles under your shoulders, and coming all the way back up to the knee. Okay, so once you've done your 3 to 5 passes on one side, then you're going to want to switch your position, roll your hips to the other direction, point your feet to the opposite direction, and work your way down that side as well. Okay? So remember on these, slow as she goes, you really don't want to force over it. If you've got a lot of knots and a lot of tension, it's going to be rather uncomfortable if you try to work over it too quickly. Okay? So just take your time, breathe with it. As you breathe in, it creates tension. As you breathe out, it releases tension. So you can use that as a mechanism to work through some soreness as well. So now that we've warmed our legs up, we've got the quads warm, on both the central, the lateral, and the medial aspects. Now we're going to go ahead and try to isolate and create a little more tension to get into those muscles a little bit deeper. So this time what we'll do is starting in the same position, but now you want to cross one leg over the other. Okay, so right over left, left over right. And as you work your way down, staying right on top of that muscle belly, and bringing your weight straight back up. Now, if you want to create a little bit more tension, you can press with your top foot onto your bottom foot and lower your chest to the ground a bit more. It'll create more of an arc in the leg and a lot more intensity, okay? So once you've done your 3 to 5 passes this way, then come back up to the knees, release, switch, and repeat 3 to 5 times on the opposite side. Alright, so we have done the front of the legs, so that's going to be all 4 quadriceps, lateralis, medialis, recfem, and sartorius. Now we're going to go ahead and switch to our back side and work on our hamstrings and our calf muscles. So this one here does require a bit of arm strength. So if you have a hard time working through this position, you can take little breaks, sit into a spot, let your arms recover, and then continue going on. You'll see what I'm talking about in just a moment. So you want to start by sitting on top of the foam roller, just like I am here, and to bring yourself back, and you're walking your way back with your arms all the way down to the heels, and then you're going to work your way all the way back up into your bottom, okay? Repeat that again 3 to 5 times. Coming back, coming forward, and like I said before, if you catch yourself needing a bit of a rest, you can come back, do the hamstrings, rest, then come back up, do the calves, rest, and then repeat that same motion going forward until you completed the full cycle. Okay. Now that we've done doubles on the back side, just like we did on the front side, we're going to now do singles. And by doing that, we are going to, again, sitting with the foam roller underneath our bottoms. You want to cross either right over left, left over right, and you are going to repeat the same motion from the first, remembering that you can push down on the heel to create some more tension, and also keeping your upper body lower to create more tension as well, okay? So as you come all the way back to the heel, all the way back up to your bottom. Repeat that 3 to 5 times. Go ahead and switch feet. And again, repeating the same thing on the opposite side. All the way back up. And done. So remember, if you have a bit of tension in one particular spot as you're rolling up, you can pause, take a deep breath, and exhale, and use the breath to control the movement as you come over that tissue. If you find it kind of popping over certain points, try going a little bit slower and also breathing in to those spots a little bit deeper. So now we have done our quads, lateral, central, medial. We've done our hamstrings and our calves, both doubles and singles. Now we're going to go into vastus lateralis and ITB on the outside, okay? So starting this one, You want to start on your side in a kind of semi-plank position, just like this. Okay, so once, I just want to slide down just a little for you guys. Cool. So again, paying attention to the joint angles underneath the shoulder. So you want to make sure that your elbows are underneath the shoulder. If it's too far out, it's going to compress the joint in a way that's not very good for the structure. And again, if you're way up under here, first of all, it's really difficult. And two, again, not good for the joint structure. So this is nice and solid. And from here, using the hand that's not resting on the elbow, you want to use that to kind of support as you reposition your elbow and you come up to the knee, okay? Coming all the way down to the hip and then coming back up to the knee. Now for this one, it's kind of important not to go over the knee because then you can start to create this lateral pressure that's not, again, good for that joint structure. So I would pause at the knee. If you want to do the calf from here, switch it down past the knee, then continue on, come up to the knee, take the weight off, reposition, and come back up, okay? I would typically focus on one area at a time so there's less interruption, but there's also, you might want to work on the lateral aspects of your calves and soleus as well, okay? So, again, repeating 3 to 5 times, then you'll just want to switch and repeat the whole process on this side. This will be the last sequence in the series. So this will be for medialis and gracilis as well. If you're finding yourself having pretty intense medial knee pain, then relaxing these muscles here is going to be really beneficial to alleviating some of that tension. Because if you think of your knee as being kind of this position, right? You got a lot of tension here, but by releasing some of this tension, you're not compressing the joint quite so much here. Now, one thing to take note of is if you release a lot of tension and then you start to feel pinching over on the lateral aspect or the aspect in opposition, then also work on the other side, which we will have done in this series already if you're doing this from start to finish, and that will allow the knee to rebalance itself accordingly, okay? So to do gracilis and medialis, I would start off lying on the floor as opposed to being on the foam roller, okay? And you want to have your foam roller perpendicular to your femur. So as you start here, working your way down to the inside of the thigh, and then crawling back up and ending at the knee. Now I like to give a little bend and a little stretch here as well. Re-engage, get some of those fascia restrictions out of there. Coming down to the inside of the thigh, to the hip, and all the way back to the knee. Good flex. Remember, repeating this 3 to 5 times per side, or as your body tells you is required. Okay, so I use the guidelines 3 to 5 per sequence just because it's a pretty good guideline. It's not too much to where you start feeling Charlie horse, and it's not so little that you're not actually recognizing a difference, or you can't actually feel where specifically in the muscle bellies your tension lies. So I find it really useful to do this whole sequence. Again, if you're preparing to go on a long trip and or a long hike or a long bike ride or any of that, and you're feeling particularly sore, this is good for that. If you're feeling any medial, lateral, or central knee pain, decompressing the joint by allowing the muscles to relax is also highly beneficial. And if you want to remove some of the waste byproducts that get stored up through exercise, like lactate or lactic acid, depending on what school of training you come from, those can start to build up as waste products in the muscles as well. And by foam rolling, you're allowing those tissues to move around. And so long as you're drinking lots of water, you can also eliminate some of those, what we'll call toxins, I'll just call them waste buildup in the muscles themselves. So, thank you all very much for being here. I appreciate you watching. And if you guys have any more questions, comments, concerns, please let me know in the comments. And if you like what you see, click like and hit that subscribe. Thank you all very much. See you next time.